Hi, I'm Lindsay Moreau. I'm a naturopathic doctor, clinical consultant with US Biotech. Today we're going over a case report of my own to help you understand how to actually use this and how it looks like in practice. So let's dive in. So this patient, I'm going to give you a little background, had fibromyalgia, and we had been working together for a good handful of months. And we got her to a point where she just had plateaued out. We had fixed her sleep, worked on hormones, worked on her diet, done some detoxy stuff, but she still was getting flares. Which was driving me crazy because I didn't feel like something like fibromyalgia should be a chronic condition. I and still believe that it should be resolvable. So we had to figure out what the heck was going on with her. So that's actually what led me to do an organic acid test on her. And this was actually one of the first ones I did. At the time, it felt really scary and overwhelming. And I was like, oh my gosh, I'm not sure what I'm doing. But now looking back, and I'm like, oh, this was actually a really good case, and we were able to make some really good changes. And it's pretty easy to read, so I thought I'd make a good case report. So let's go through. So the first thing to note is whenever you're looking at a organic acid test, you always want your markers to be somewhere between that 30-70% range. We're ignoring the color, which I know it's silly to have all those amazing colors and have to ignore them, but there it is. So that's number one. Number two is you always want to make sure that you know what your medications and supplements that you have that patient on. And number three is you need to know their diet because that will impact some of their markers. So keep that in mind as we go through. So this patient, no medications, pretty standard American diet, healthy version, of course, but nothing remarkable there. So equal parts carbs, fats, and proteins. So the very first section we're looking at for her is glycolysis. Now, glycolysis tells you about how your body's processing carbohydrates. So that's a really important one. And so if you're not eating a lot of carbs, I would expect these numbers to be lower. If you're eating a high carbohydrate diet, we'd expect them to be a bit higher. And if you don't see that, then there's something wrong with your carbohydrate processing. But for her, everything looked really good. Her pyruvate at 41 looked really nice. Little bit of a split between pyruvate and lactate. That can be indicative of needing B3, could be indicative of some phthalate issues, but overall, I was pretty okay with her numbers. And then we're seeing as she goes down to the citric acid cycle, pyruvate feeds right into the citrate. So that citrate should always be at least as high as pyruvate, and hers is actually a bit higher, so probably feeding in from fats. And so then, if it goes too high, it's oxidative stress. So we don't want that, but she's kind of around that border. So I'm decided to leave that alone. But we do see that as she goes from citrate down to cisaconate, back up to isocitrate, that's actually a pretty clear pattern of oxidative stress. So we really need to work on that with her. That's our first clue of many that, okay, you're just really inflamed. So there's nothing to be done to support those enzymes besides working on the oxidative stress. You could give her antioxidants, but I always think, okay, if we can figure out where the inflammation is coming from, that's also pretty effective. And then we drop into isocitrate, alpha-ketoglutarate, and succinate. Those numbers are all about even with one another, those percentages, so pretty decent. But then where she gets into trouble is she goes from succinate to fumarate. You see that big drop there, or that big gap between those two numbers? That's a problem. So especially with her and having fibromyalgia, that spot exactly in electron transport, it goes to the electron transport chain. And so the electron transport chain is really important for generating ATP. It generates far more ATP than the actual citric acid cycle does. So that was a big clue for us. And that was a huge action item of, okay, we specifically need to work on this. So CoQ10 was really important. Resveratrol of all the antioxidants is the most indicated, and then a handful of B vitamins as well. And some of those minerals like copper and iron. So certainly we looked at that for her. Then we look at fumarate and malate. Fumarate and malate are both quite low, comparatively speaking. Malate, especially at a 15%, is pretty terrible. Low malate's associated with chronic fatigue. So that was another big marker for us and an area that we could intervene. We could just switch her magnesium from a magnesium bisglycinate to a magnesium malate and support her energy that way. So that was a really cool thing to learn too. Then we're going to drop into the next section. So the next section is her fatty acid oxidation. This is mostly reflective of how you're processing the fats in your diet. So again, she's on a moderate fat diet, not too high, not too low. So these markers are looking pretty good, with the exception of subrate. So subrate is a bit popped up, and whenever you see that, everything else is normal, but then one of those markers is really high, you want to think about, okay, well, what else drives that? It's probably not just her diet. So for her, that's a sign that she could have glucose dysregulation. So thinking about that, so we kind of write that down and kind of keep in the back of our head. Otherwise, everything else looks pretty good in that section. You could argue that she needs to cut back on her fats a little bit because citrate is at 71%. It's an oxidative stress if it's too high, but I decided to not nitpick that with her. So then we're going to drop into markers of protein metabolism. So this is an important section to understand how are you using amino acids. I was particularly interested in this for her because amino acids are a critical part of recovery. And sure enough, she did have some dysregulation here. So alpha keto isovalerate kind of high, and then she drops down, then she bounces back up, and then she's got beta hydroxy isovalerate way too high. And so she definitely needed some support processing her amino acids. So one of the things you can do is just support those with B1 through 6. Iron, molybdenum, alpha-lipoic acid, certainly, and then specifically beta-hydroxy isovalerate, that one uses biotin as well. And so with her, biotin did make sense because, a history of gut issues can lead you to having a B7 deficiency since that is made in the gut. So that was certainly an interesting finding there. Methylmalonate, a bit low, but it kind of made sense if you look at ethylmalonate and methylsuccinate. So you always compare those three together, and they're roughly in the same ballpark. So that was one that I was like, we decided to leave that alone, even though it wasn't perfect. Then we drop down to hydroxymethylglutarate. That one is on the pathway to making CoQ10. So I always get concerned when that one's low. And I usually am just jumping right to, hey, let's support your body with some CoQ10, one of my favorite antioxidants. And then we saw more need for CoQ10 based on the fact that she couldn't drop from succinate to fumarate. CoQ10 is helpful there. So that was kind of an obvious one to support her with. So then we get to the ketone metabolites. So your ketone metabolites, everybody should always have some, but you don't want them to be too high. You certainly don't want them to be too low. If they're both high, it can be a sign of fasting or ketogenic diet. It can also be signs of oxidative stress because they are used as antioxidants in the body. But this is a pretty common pattern where you have alpha hydroxybutyrate kind of high and beta hydroxybutyrate like not measurable. So when we see alpha hydroxybutyrate being high, again, it could be oxidative stress. It could be blood sugar. So that would be another mark in favor of blood sugar. It could be from dysbiosis, biotin again. So not really any clear action items with the alpha hydroxybutyrate. It's more of a guide to help us understand what do we do with the other markers and how do we make sense of that information. And then when we look at her beta hydroxybutyrate and seeing that one being super low, that one is very much liver. So that kind of puts us a little bit more towards, we want to support blood sugar and like liver health more specifically. So B3 and choline are really helpful for boosting beta hydroxybutyrate, but certainly just overall liver support would be really helpful for her. And you'll get an idea of why as we go through the rest of this test. The next section is markers of neurotransmitter metabolism. So I think this is the hardest section because you have to be really mindful of your patient's symptoms. The markers could be high if you are just clearing a ton of neurotransmitters, which would leave you with low neurotransmitters, or it could be high because you're making a ton of neurotransmitters and you would have normal levels. So that can be kind of tricky. Same thing if it's low, right? So if your markers for neurotransmitter metabolism are low, either you're not clearing things, which leaves your actual neurotransmitters quite high, or you're not making any, so you have low metabolites. So you really have to be careful in this section. I generally leave things alone unless we're specifically working on mental health. So for this patient, she wasn't having any specific mental health concerns, so we decided to actually leave this alone. And focus more in on the inflammatory information that we're getting from the neurotransmitter section. So vanilmandulate, homovalinate, and 5-hydroxyindolyl acetate, respectively, adrenaline, dopamine, and serotonin, fine. Quinolinate and kynurenate, markers for neuroinflammation, pretty bad. So she definitely, this is another marker for her. Okay, this is maybe our third one that, yep, you're inflamed. And so the way you get these to drop is you work on the inflammation. You can support each one specifically with certain things. So B6, zinc, and antioxidants, of course, for quinolinate, B2 and B3 for kynurenate. And her kynurenate is higher than her quinolinate, which is certainly neuroprotective, but you just really don't want them to be that high. So working on that. This is a common pattern that you'll see if somebody's got a lot of brain fog. So it's certainly worth working on. The next section for us is the markers of detoxification. I love this section. You get a lot of good information about how somebody is able to process things out. And so when we look at her, the very first one, para-hydroxyphenolactate, a bit low at a 19%. So we want to support her phase 2 detoxification, glucuronidation, specifically transsulfation, really important here. So we can give her calcium deglucarate, we can give her B6 and check her iron are really important parts of detox. There's a whole slew of amino acids you can use to support that. So there's a lot of different ways to support her phase 2 detox, but we certainly want to do that. And that might also help with her hormone balance. The next marker is orotate. Orotate looks good. I didn't do anything for that one. It is on the pathway to DNA repair, so I was kind of suspect to see what it ended up looking like since she did have a hard time recovering, but hers looked really good. On the other hand, her pyroglutamate, pretty bad. So pyroglutamate is on the path of making glutathione. So if it's really high or really low, it's a good time to use glutathione. You can, of course, give that patient the supports they need to make their own glutathione, like NAC and glycine and B6 and all that stuff. Or selenium too is really great, which I don't have a problem doing. But in her situation, because she was just so symptomatic, it made more sense to just go right with the glutathione. And glutathione is also really helpful for detoxification. So it made sense, since we know she needs help detoxing. We know she's super inflamed. Let's give her support on multiple levels there. And then her next marker, so that's pyroglutamate. The next one is benzoate, and her benzoate was definitely a problem. So you should never see benzoate be measurable on this test, because it should get processed out of the body within 4 hours. And this is a first morning urine void. So it should be like 8 hours in, right? So that's a big problem. So we actually wanted to support the glycine deportation system. So we gave her glycine, which was great because she wasn't getting the best deep sleep. She felt like that needed a little bit more work, and the glycine actually did make a big difference there. But obviously, to clear that benzoate, we need to focus on that. So that was a big deal for her. So detoxification overall, kind of a failed section for her. The next section is the markers of bacterial metabolism. That looked pretty good. Maybe a smidge high in the first couple, but not worth really doing anything about based on all the other things that we found. And we had done a lot of gut work. She'd already tested her food sensitivities, and she knew exactly which foods bothered her. So we decided no more intervention necessary there. But I do want to point out that her tricarballylate marker was elevated, certainly more than I like to see that. That's one of those markers that lower is always better, because it can be indicative of E. coli, but it can also be indicative of Fusarium mold. And so if somebody's kind of mold sensitive or just not good at processing it out, that can cause a big issue. So thinking about your commonly moldy foods in that scenario to help lower that number, avoiding those for a time. The next page is not part of the organic acids, but I want you to have this, since we did do this with her. It's the environmental pollutants profile. I love this because it really springboards the conversation with the patient about, hey, you really do need to clean up your skincare. Hey, we got to stop using plastic containers. And so for her, it was a big wake-up call, because this is where a lot of her inflammation is coming from, because she's getting exposed to toxins. We now know she's not detoxing things very well. So that's the perfect storm. So her xylene was okay. Toluene, we already talked about the benzoate. So that was really bad. Benzene, quite high. Benzene's aromatic. So think about your perfumes, anything with a fragrance, anything that is sprayed. I always think about any of the cleaning chemicals that you use, like even Windex, that could have benzene in it. I don't know off the top of my head though. Styrene, her styrene was also quite high. That's plastic. So you really want to go through and have them go through day by day. Okay, what are all the different things you use that are plastic? And some things are unavoidable, like for instance, is your house newer? Well, then you've got PVC piping, you can't avoid that plastic from exposure from the water, but there's a lot of other ways you can lower that number. So definitely sitting down and working through that. And then she also failed in the phthalates and the parabens. Those are all quite high. And those are usually, when we see both of those elevated together, I'm thinking about body care products and things that you put on the skin. So we really had to sit down and make her go through everything she's putting on her skin to make sure that to figure out where that exposure was coming from. The last marker is methyl tert butyl ether. That's from gasoline, or it is found in some medications because it's used as a solvent. And hers was quite high. So we had to work on that, and okay, let's talk about your commute and kind of dig through that as well, since we knew she wasn't on any medications. So that's her whole test. So what we ended up doing with her is we just tweaked some of her regimen. So switching out her magnesium, doing a magnesium malate, which actually made a huge difference. We actually boosted her glutamine, which we didn't talk about, but alpha ketoglutarate, because she was on glutamine, we would have expected it to be higher. And it can be a really important part of recovery. So we actually doubled her intakes up to 2 teaspoons of that, which she really liked. And that would hopefully also fuel and get her more stuff to go into the electron transport chain. CoQ10 was really important for her, and the glutathione as well. So a couple small changes to her regimen was able to make a big difference. She hasn't had a flare since we implemented this. Obviously, she did all the lifestyle stuff as well, which made a huge difference, probably the bigger difference of all. But she was really happy, and so was I, that we finally figured out why she kept having those fibromyalgia flares and why we couldn't get her to a place of resilience. So that's the end of this case report. We'll be doing some more. If you have questions, or if you want to start using the organic acid test and you want somebody to help walk you through your first couple results, I do clinical consultants exactly for that. So you can talk to your US Biotech rep to get my link. I look forward to working with you all, and we'll talk to you soon.